is in the call. Yes, I want to confirm whether we have these counties in the call. So one, do we have Team Busia in the call? Team Busia, do we have Team Busia, facility team, the county team or the sub-county team?
Good afternoon, Songkok.
Yes, good afternoon, Daniel.
This is Daniel Afubwa, Skasko Butler. I also double up as the county YP coordinator. Our teams are soon joining.
Kindly reach out quickly to the county teams because this training is very important. So the county and the facility teams, kindly.
Noted.
Thank you. Kajiado. Kajiado, we don't have anyone. Purity. Purity, if you're speaking, we can't hear you. All right, Purity, you can reach out to your other colleagues to also join. Kakamega.
Good afternoon, Dr. Kore Casco Kakamega. We have contacted the other participants, including health facilities, to join. Thank you.
Thank you very much, Doc. Much appreciated. Please, let's mobilize the other teams to join. Kiambu. Team Kiambu. All right. Meanwhile, we can go to Kisii County.
Good afternoon, Kisii County. A few of us have logged in. We are reaching out to the others also to log in. Thank you.
Thank you, Florence. That's the Casco Kisii. Migori.
Yes, Migori is here. That people are coming.
Thank you, Elizabeth. All right, thank you. Kindly, let's reach out to other teams to join. Mombasa. Mombasa County. So we don't have anyone from Mombasa so far. Okay. Nairobi.
Good afternoon, Songok. Probably we just have a few in from Nairobi. Get more to join in.
Thank you, Kibanda. Kindly, let's reach out to Team Nairobi. Nakuru.
Good afternoon, Songok. Nakuru, we are in and some are still joining.
Thank you, Rachel. Reach out to your team members. And also let's reach out to the CHRIOs and the sub-county HRIOs, the sub-CASCOs. We would really want them to be part of this conversation. Thank you, Nakuru. Uasin Gishu, last but not least. Uasin Gishu. Team Uasin Gishu. Anyone from Ampath?
Yes, good afternoon, Songkok and team. Uasin Gishu, the other team are joining, so shortly.
Thank you, Christopher. please reach out to the teams, especially the facility, the sub-county, and the county teams. Kindly ask them to join the call. So I'll go back to Kajiado. Just one more check. Kajiado, do we have anyone who's joined from Kajiado? Lydia, I can see you have unmuted. Are you from Kajiado? Kajiado team, Lydia, are you part of the team from Kajiado? Okay, Kiambu? All right. More.
Songok, I'm not sure if you're still speaking. This is Dr. Mambo. Eunice, can you hear me? Eunice Kinywa?
Yes, I can hear you, Doc. I actually had a question regarding the schedule, because according to the email, there are two clusters. One cluster is today afternoon. The second cluster is tomorrow in the morning. But according to the email with the link, it is talking about, it's giving us every 2 days from 2 p.m. So maybe that clarity will help. I know some of the Kisumu team may also be joining in today, but kindly clarify to allow us organize ourselves well. Thanks.
Sorry, I got dropped at some point. I think I had a problem with my
Okay,
network.
so Songok, Eunice was seeking clarity on the attendance because the meetings have been set it's a recurring link for every 2 days. I believe that's an error because it's supposed to be a meeting today and tomorrow, right?
Yes. That's correct. That's correct, Doc. And actually, for Team Kisumu, they're supposed to join tomorrow at 9. So we'll be able to just work on the link to change the timing to tomorrow night. So we have only two meetings or two trainings, this one and tomorrow. Eunice, apologies for that, for the inconvenience.
Yeah, but we may have some of our team members joining in today.
No problem. We'll still proceed with them. No problem.
Okay, Songok, I'm requesting to just do my part because I have a competing meeting and I need to drop off.
That's okay, Doc. Just go ahead, please.
Okay. Great. So good afternoon, everyone, and thank you all for joining this meeting that has been called to sort of align us with the plan to roll out long-acting PrEP. My name is Dr. Barbara Mambo. I work at NASCOP. I work within the combination prevention section. I am the team lead. So I hope we have all seen that Lenacapavir has arrived in country. It arrived 2 nights ago. We are quite excited about the prospect of Len changing the whole dynamic and helping us close the new infections that we will anticipate in the next coming, at least reduce them significantly. So I was asked just to go through a few things of what our implementation plan is. Oops, I do not know what I pressed. Is my slide set still up? Okay. Songo, can you hear me?
Yes, we can hear you. The slides are also are on.
Okay, great. So I'm just going to give an overview of what PrEP is and why it matters. So it's not our first time to encounter PrEP in Kenya. We rolled out PrEP for the first time in 2016. I believe it was in the 2016 guidelines where we had it as daily oral pills. But what the difference is now, we are looking at long-acting injections, which can happen every 2 to 6 months. Why does it matter? Is because it has been proven to reduce the risk of acquiring HIV by over 90% when used correctly. So this also supports our plan to end new HIV infections in the country by 2027. As I said, we have to remember we are always trying to close the tap so that we do not get new infections. There's global shifts. Both WHO and FDA approved cabotegravir and Lenacapavir, and countries worldwide are also moving towards long-acting PrEP. Kenya was one of the first countries to receive, in sub-Saharan Africa, to receive long-acting PrEP behind, I believe it's Eswatini and Zambia that have already started a rollout. But remember, for all the countries, no one has reached the 6-month mark where patients have to come back to receive their next injection. So we want to scale up nationally, but we're going to start out in a phased approach, starting off with a few counties, and the data we will use the data to guide the rollout and national policy and scale up. So what is PrEP? PrEP has been recommended by WHO. There are 4 products that we're going to use as PrEP. We have the oral PrEP, which contains tenofovir, that is TDF. We started using that in 2015. Then we shifted to dapivirine ring. Not shifted, we added on. Every product is an add-on. We added on dapivirine vaginal ring in 2021. We are also expecting a consignment of dapivirine ring to come in country. Then we got long-acting injectable cabotegravir. That was in 2022. So both dapivirine ring and long-acting cabotegravir were included in the guidelines, in the 2022 guidelines. But now we have this long-acting injectable Lenacapavir, which was in the 2025, which has just been approved in 2025, and we will see it in the upcoming guidelines. So it's as part of the comprehensive HIV prevention approach, and based on effectiveness, safety, community values and preferences, and also matters like cost. So this is just telling us when Len and Kabele when they were approved and when they were recommended. Of interest here is to know that Lenacapavir is an injectable every 6 months, and cabotegravir is an injectable every 2 months. Both of them will be available in the 15 counties in the selected sites. The CASCOs are the ones who came up with the site selection after we had already given them like the criteria that we are looking for. Kabele is we're not planning scale up of Kabele beyond the 15 counties, but again, it will depend on data and it will depend on performance as well. So the phase 1 counties are Kisumu, Mombasa, Nairobi, Migori, Homa Bay, Siaya, Kisii, Kajiado, Busia, Machakos, Kilifi, Nakuru, Uasin Gishu, Kiambu, and Kakamega. The reason these counties were selected is we looked at counties that were high in the new HIV infections. We started with the top 10 counties and we added on 5 more. They have high HIV disease burden. They have a strong program. They already have demonstrated HIV prevention capacity and delivery systems. They all have had PrEP experience. And also they have presence of the priority population. As much as we say PrEP is for those who are on ongoing risk, we do note that there are some priority populations that we are looking at, especially the key populations, our adolescent girls and young women, and the pregnant and breastfeeding women who are eligible for PrEP as well, for long-acting PrEP, and it will at least help reduce the the MTCT rates. So these are the counties. I already talked about phase 1 counties. Phase 2 counties, which will be another 15 counties, Wajir, Samburu, Kwale, Turkana, Nandi, Kericho, Garissa, Nyandarua, Isiolo, Muranga, Embu, Marsabit, Tana River, Makueni, and Meru. And then finally, we will go into phase 3 counties that are Nyamira, Lamu, West Pokot, Nyeri, Trans Nzoia, Narok, Mandera, Kirinyaga, Bomet, Kitui, Laikipia, Taita Taveta, Vihiga, Elgeyo Marakwet, Tharaka, Baringo, and Bungoma. So we hope that in the spirit of equity, we want that all counties should be able to experience long-acting PrEP with the donations that we're getting. We hope that we'll be able to provide EMR solutions to the counties which do not have active EMR systems. And all PrEP is being rolled out as choice-based. It is not being imposed on anyone to take one type of PrEP. And in fact, it's going to be rolled out with both the oral options are still available, then Lenacapavir and Cabotegravir. And when vaginal dapivirine ring is available, it will also be put on the table as an option for a client to select what it is that they would prefer to use. And this is what we call PrEP choice. So we are rolling it out on the principle of PrEP choice. So we have sequential expansion, meaning that we are not going to wait to reach 100% of our targets in any county. We are going to move to the next phase once we reach 25% of the counties, of the targets in the current phase. This is to allow us to have the other counties also experience PrEP while we are still with our first initial donation pack that has just landed in country. So now for the facility selection, we have, for all the counties that have been selected, they were advised to select 10 facilities per county. And this is the criteria for the facility selection. Of course, it's high burden sites, presence of the target populations. These are the vulnerable groups. KenyaEMR was very important, and showing efficient use of KenyaEMR. People who already have PrEP experience, meaning that they have clients who are on oral PrEP, and readiness criteria. So the CASCOs had they did an activity a few weeks ago where they went through all of the selected sites, the sites that we had proposed that met our criteria nationally, and they had to go through to determine if the sites really had met the readiness criteria. And those are the sites now that we have been that they forwarded back to us, and those are the sites that will be expecting the distribution of both Lenacapavir and Kabele. So the monitoring framework, these are the indicators that we want to track. We have already revised the existing M&E tools to capture all of the new PrEP methods, and our reporting should also leverage on the KHIS and EMR systems, as well as the National Data Warehouse. So the process indicators being tracked at the facilities offering PrEP, the number of healthcare workers trained, the eligible clients, and if we have pharmacovigilance systems in place. It's especially important for us to monitor adverse drug reactions, and especially since we're using PrEP within the pregnant and breastfeeding women, which is a very sensitive population. The output indicators are initiations by method. We want to look at switching patterns because clients can decide to switch between either of the PrEP options that are available. We're going to look at the retention and discontinuation on PrEP, and also the adverse drug reactions. The outcome indicators being tracked is the HIV incidence, the coverage in high-risk groups, any seroconversions. We have to look at the seroconversions. If somebody becomes HIV positive while on PrEP, this is a matter of public health interest and needs to be reported. And of course, with PrEP, we know that there's an increased risk of getting STI. So then we're also looking at STI diagnosis. And finally, we'll look at impact, the cost effectiveness. If we see a reduction in the HIV incidence, which is the whole point of having high-risk clients on PrEP, and the prevention coverage gains. So right now, the challenges that we had been experiencing is we had low utilization of the PrEP EMR module and a limited capacity to fully use the EMR. And I suppose this is where we come in now with this training, trying to build up the capacity to utilize the EMR, especially since we already have the product in country. We're looking at launching, having our first patient injected, not first patient, our first client injected next week in Nairobi as the distribution to the other counties continues. So that is all from me, and back to you, Songok.
Thank you. Thank you very much, Dr. Barbara, for taking us through that first part of the presentation, just to give us a quick highlight on what we expect in as far as the rollout of PrEP is concerned. So thanks so much. Because of time, allow me to then just go straight into our presentation. I know we have the other team members will remain in the call. I know Dr. Barbara, you'd indicated that you'll be dropping off, but being Ruth, Paul, and the other team members will be in the call, so that in case there are any, they'll be able to assist. But thanks. Thank you very much, Doc. Right. So I think at this point, allow me to welcome Otieno, who will take us through the first part of the presentation. We've divided these sessions into two sessions, basically. So the first part of our presentation will focus majorly on the introductory, which would be the TaifaCare overview, the clinical management workflow, the laboratory workflow, and the pharmacy drug dispensing. Session 2 will zero down to just looking at the PrEP workflow more specifically, and that will cover the PrEP module workflow, the data transmission, capacity building resources, where we're able to get some of those SOPs and the short videos. And then after that, we'll open it. I mean, we'll just go to the next steps, as in when are we expected to ensure that we upgrade all our sites. Then we should be able to close. Tentatively, I think we are purposed to be here up to around 5. But hopefully we finish, or if we conclude our discussions early, the better. So without much ado, allow me to hand this over to Otieno, who will take us through the first part. Otieno, once you're done, you can usher in Mary Ann, who will take us through the clinical workflow. Mary Ann, you will usher in Moses, and Moses, you'll be able to welcome Ogutu to take us through the pharmacy drug dispensing. That would cover the first part. Then we'll go to the second part. So thanks, and over to you, Otieno.
Thank you, Songo. Please confirm I'm audible from your end.
Yeah, loud and clear. Proceed.
Thank you. I will be sharing my screen. Yeah, again, you can confirm if the screen is visible from your end, Songo. Okay, so good afternoon, everyone, and welcome to this training. So our training today will be focusing much on the TaifaCare powered by KenyaEMR. We acknowledge the fact that some, if not most, of the participants that are attending today's session may not have had access or interaction with this version of KenyaEMR. So we'll be just providing highlights and overview of various components of this system, so that even as you upgrade and use the system, you're able to know where to get what. So to begin, this would be the homepage of the TaifaCare powered by KenyaEMR. So we have a dashboard that will be showing some data that you'll be interacting with. So you'll be able to see the top 10 disease under 5, the top 10 disease for over 5. You'll be able to see the OPD attendance, number of referrals, number of admissions and all. And this applies specifically to facilities that are implementing TaifaCare as part of the facility-wide system. But for the facilities that will be implementing it purely for CCC, maybe that data might not really populate the way it is on your screen. So that will be the home page when you log in for the first time. I would want to just go through different sections a bit fast, so that we know where to get what. So after the dashboard, we have the registration. So this is how the registration page will look like once the facility is upgraded. And this registration complies with the DHA requirement that all patients must be registered automatically by use of their IDs. So what happens is that the patient will be required to provide their national identification number, and that will be entered in that particular box. I'll just use a random one. And then the system will do a search from Health Information Exchange. Kindly mute whoever is talking. Yeah, so this will do a search from the Health Information Exchange, and the patient details will be obtained, and then there'll be a requirement for you to send a one-time password to the patient as part of data protection compliance to ensure that patient allows you to pull their records from HIE into this particular system. So that is how going forward, patient registration and onboarding will take place through the use of the national identification number. Now, this requires a bit of configuration that will have to be done. To your instance, and also there has to be a certain level of non-disclosure agreement between the county and the partner to ensure that we comply with the data privacy and data security requirements. For patients that do not have the national ID, you can still register through the emergency registration, just the normal way that you have been registering currently. Okay. Yeah, so that is about the registration. Then let's mute our mics kindly. Next is the triage. So right now, if you look at the left navigation pane, it is organized in a way that it takes care of the patient workflow, right from the registration, triage, consultation, all the way to the mortuary for cases where the patient loses their lives during the service provision. So that makes it very easier to navigate for the care providers. So from triage, you can configure different rooms for triage. For instance, as you can see on your screen, we have triage room 1, 2, 3, all the way. All these are configurable so that if you are a provider sitting at maybe triage room number 2, you just settle under the room number 2, and every patient that is queued in that triage room, you'll be able to see them under triage room number 2. So that is important so that if you have multiple triaging locations, then you are able to just move the patients across different triage service points. Next, we have the consultation. So for the consultation also, the same applies. So we have the HTS as part of the consultation. We have consultation room 1 all the way to eye clinic and all these other consultations. Again, these are all configurable. You can call them the way you want to call them for your facility. So these are just for test purposes, but you can call yours the way you want to call them under consultation, depending on the rooms depending on the consultation rooms that are available in your setup. Again, that also goes for MCH. So for MCH, again, we have the MCH triage, we have the MCH consultation. You can configure those the way you'd like them to be. So long as you have triage room in your MCH or you have a consultation in your MCH, those are supposed to be entirely configurable. Then for patients that require admission, you'll be able to configure different wards. As you can see, we have different wards. So for facilities that are implementing this system for facility-wide, the system supports comprehensive inpatient workflow. So you are able to add all your wards here, and you're able to have like statistics of your wards. And when you when you go into any of the wards, you're able to see how many patients are admitted in that particular ward, how many are awaiting admission, how many are in the discharging state, and how many have been discharged. So all that is available from the admission tab. Then for procedures, for any procedure ordered by a clinician or ordered from the outpatient, you'll be able to see the procedures ordered under this list. And when you accept them, they become part of your work list. So you'll be seeing the ones that you've accepted. And then if at all you've referred any out of the facility to a different facility, you'll be able to have them listed under that. Then we have a tab for not done and also tab for procedures that have been completed. So that is also there, and you have a chance to also add new procedure order if at all maybe it was you want to manually add the procedure order at this particular stage. For radiology, again, we also have the same. All the radiology orders made from a patient or made by a doctor, they should come as part of the order list, active orders. Then once you accept, they are moved to work list. If the test is referred out, then they'll be listed under that. Then we have the pending review, approved, and the radiology and imaging that are not done. And again, you can also add imaging order at that point, if at all you'd like to manually order it at that site. The next one is the laboratory. Again, the workflow remains the same. The doctor orders for laboratory tests. It comes under the test ordered. For instance, we can see Melissa Charles. We can see that they have an order for this particular test. VDRL has been ordered, and again, another test for blood smear has been also ordered. So at the lab, they're able to pick up the request or reject the request, depending on what decision they have. And then once they pick them up, it becomes part of the progress. Again, once the results are issued, they are moved to completed. Or if the test was ordered, was rejected, sorry, then it is placed under the declined test. Next is the pharmacy. Again, as a pharmacist, your work will be to just stay on the pharmacist screen, where you will be able to interact with all the prescriptions that are coming in from the doctor. You'll be able to make a decision on whether to close, pause, or print, especially in cases where the drug is not available. You can print a prescription and give the patient to go and buy from outside. Otherwise, in most cases, if at all the medication is supposed to be paid for, you'll be able to raise a bill and then have that bill paid up. Once that is done, you'll be able to get a dispense button where you're able to dispense and give the patient the medication. Accounting is entirely for cash management within the facility workflow. So for all the bills, the pending bills that are supposed to be paid by the patient, all that can be done from this screen, where you'll be able to interact with the patient and also have them pay their bills. Should there be any chargeable service or item that they have consumed during their visit of the facility. So again, this is also for the facilities that are implementing facility-wide. It is a whole comprehensive billing module that then they can interact with. Then we have reports, and lastly, we have mortuary. So all that is available for facilities, especially those that are implementing facility-wide. But it is good for you to understand where to get what, even as you're going to upgrade to this particular version. Then let me go to the triage and pick a patient so that you also see the patient profile. So if I pick maybe Melissa, we'll be able to see we'll be able to interact with the patient profile. So under patient profile, we'll be able to interact with the patient summary. Under patient summary, we have all this. So we have the patient summary tab, we have the vitals and anthropometrics. We have the care panel now under patient summary. And under care panel, this is where we can be able to enroll a patient into a given program, especially today talking about PrEP program, we'll be able to see how a patient can be enrolled into the PrEP program. So all these programs are here, including HIV program. A patient must be enrolled in this particular program for you to interact with their forms under the encounter forms. Okay. Then we have the tabs for immunization, relationships, appointment, and any attachment. I would want to go through that. Again, also under clinical encounter. Under clinical encounter, we are able to interact with the previous visits. So we'll be having a whole list of the visits by this patient. We are able to edit or look at the details under each of those encounters and what was captured, like you can see, and you're able to edit that should you want to edit. Then there are special clinics again. There's a whole list of special clinics, all the way from audiology, all the way to oncology, to urology, all that is available, and you are able to interact with those forms under special clinics, which is found under the clinical encounter. Lab orders is a list of all the lab orders that have been ordered for this patient ever since they started receiving care in this facility, and the results for each of those will also appear under the test results. That goes for the radiology and imaging. That also goes for procedures. You'll be able to interact with the procedures that the patient has been ordered for under that. And all this belong to this particular patient, not to any other patient. Then the prescriptions, again, you have the medication history. So you have the active medication and you have the past medication. So all that will be listed under the prescription. And if at all this patient is an inpatient, then you'll be able to interact with the inpatient forms, like the admission request, and also the admission details, and also the inpatient forms that are available within the system. So that is about the patient profile. And again, you'll be able to assign a patient to any other queue, maybe let's say from triage to clinical consultation. You just assign it to that queue. Then the patient will be able to now appear in that particular queue. Then on this other side, we still have the same order basket where we'll be able to order for medication. For instance, if we'll be able to order for Lenacapavir, we'll be able to use this to order for that. Then we have also the laboratory orders, which I've talked about. We've talked about the imaging orders and procedure orders. All these orders can be made by a clinician or a doctor so that the patient can receive those particular services. Encounter forms still remain where they were. You still have the list of all the encounter forms. Some of the forms are hidden. You are not able to interact with them simply because maybe the patient has not been enrolled in that particular. Let us mute kindly. Yeah, so some forms are not being shown to us because maybe the patient has not been enrolled in that particular program, so those forms are hidden. But as you enroll the patient into different programs, the forms that are associated with that program will be shown, and you'll be able to interact with them. The last bit is the clinical notes, the visit notes. This can be used by a doctor for additional notes that maybe they want to make as part and parcel of this particular patient's profile. They'll be able to add those notes right there. Then last but not least, I want to focus on the green ribbon up here. So we have, again, an option for searching. This will do a local search for patients that are within the system. So for instance, if a patient we have is called Mary, we can just search for them either by the ID or by anything else. But DHS strongly recommend that when searching for a patient, you search using their national ID that is available. So you can search using that, and then the patient with that particular ID will come up, so that then you can proceed with providing the services. This icon, add patient, still act as emergency registration for patients that we cannot pull from the HIE. Then we have the user management, and then we have additional modules that then you can interact with. For instance, you can interact with the lab manifest, you can interact with the dispensing app, you are able to interact with the bed management for configuring the inpatient module and any other module that is available. For instance, for managing stock, the system has a whole comprehensive module for managing stock for our facilities. And we'll be able to show you how that works later on. So in summary, that is how the system looks like and where to get what. So I believe at this point, you are able to see where you're able to interact with the different forms, different services for your particular patients. So at this point, I want to just call upon Marianne to take us through the next section. Marianne, if you are available.
Thank you, Otieno. Good afternoon. Kindly confirm I'm audible as I share my screen.
Yes, you are.
Yes, you are audible.
You're okay.
Thank you. So I will start off from where Otieno has reached. Good afternoon, team. My name is Marianne Mwangi. I want to take us through the available clinical management workflows, especially for HTS and CCC management, by looking at two different scenarios or by using two patients so that we can be able to learn how to offer preventive and HIV care services using TaifaCare. So when a patient comes and we're able to identify them, either by pulling the information from the client registry, a user will be able to check the mean so that they can determine what the patient has come to the facility for, 2, how they will be paying, and 3, queue them for the very first service. So I'm going to take the assumption that our patient has come, they have been identified at the registration desk, they have been registered, the information has been pulled, they have been checked in, and they have been queued to the first service as to access triad services within the OPD. So within the OPD, we're able to see that we have different rooms from triad. From the triad tab, we can see we have consultation triad room 1, room 2, and room 3. So our patient was queued to consultation triad room 2, and I'm going to search for them. So my patient was called PrEP Thursday training. And once we identify our patients, now we can be able to offer the services that are offered in this particular service room for triad. So once we identify our patient, towards the far end where we have the patient name and the other details, the status is that they're waiting for triad, they have been queued to this triad room. We'll be able to see even how long they've been waiting in our queue, and now we can be able to, at the far end where we have the 3 dots, we'll be able to call in the mean into the room so that we can be able to offer service. So when we do that, the system will allow us to see the patient we have just called, confirm it is them. If the patient is not available, you've called them from the queue, they're not available, maybe they've gone out to do something, the system allows you to requeue them so that you can be able to serve the next available patient. But for now, we're going to assume our patient has come into the room, we've confirmed it is them that we are serving, and we can proceed to serve. So when we do that, the system will direct us to the patient homepage that Otieno had just explained. And the most important thing that we need to do here is to ensure that we record vitals for our patient. So the system allows us to do this in different ways from the patient homepage. 1, there's a provision for recording vitals at the far right end, where this particular link will lead us to the triage form, or we can use the forms icon, the clinical forms icon, and access the triage form from here. So once we click on this, it is going to give us the same triage form. Or again, from the patient profile, where we have vitals and anthropometric, again, we can also be able to add different vitals. We can be able to add specific vitals. We can be able to add specific biometric information about our patient. So to start us off, we're going to record vitals using the link for recording vitals. And you will notice within the patient homepage, there is no data that has been recorded for this particular patient for vitals or any biometric information. So by selecting record vitals, the system will be able to generate or give us the triad form, and we can now be able to fill these particular details for our patient. So for the visit details, the system is going to auto-pick the date that this particular service is being offered, the provider who is offering this particular service, and from which particular location where this service is being offered to. Then now we can proceed to filling the triage form. So we'll start by the first section for complaints and history of complaints, where we ask the patient whether they're having any complaints today, and they may say yes. If they say yes, then we'll need to fill all the presenting complaints, and we can be able to add as many as the patient says they have. So in our particular case, our patient will say they have no complaints. When we physically assess the patient, we'll need to determine whether the patient mobility assessment, whether they are walking, are they walking with help, or are they on a stretcher, they are immobile. So for our instance, we're going to say our patient is walking. Then we also need to determine if our patient has had any injury within the last 48 hours. It can either be a yes or a no. For us, we're going to select no. Then the patient level of consciousness also needs to be assessed. Is our patient alert? Do they react to voice? Do they react to pain? Are they unresponsive, or are they confused? For this instance, we're going to say our patient is fully alert. And then we can proceed to fill the vital signs, starting with temperature. So for this patient, we have taken a temperature reading, and it is at around 35.8. And we use the thermogun for that. Then the pulse rate for our patient, it's going to be 70. Then we're also going to take the blood pressure. Systolic pressure is going to be 114. The diastolic is going to be 75. Then the respiratory rate for our patients, we can say around 16. Oxygen saturation, it can be around 98%. Then the mode of collection for this, maybe we used room air, and we can proceed now to the anthropometric section, where we need to take specific biometric information. Starting with weights, for our patient, we're going to say they are 32 kgs, height around 130 centimeters, and the system will be able to automatically calculate BMI for us, which is at 18.9, categorized nutritional status as normal. Then because our patient is a female, we may need now to answer more questions depending on the type of patients that you have. For our case, we have a female, so we may find this question for last menstrual period dates popping up. We can say sometime in December 31st. And the system now, having filled the presenting complaints, the physical assessment, and the vital signs, will be able now to score or give us TU score. This is a triage early warning score, which is a composite score from all the patient presenting physiology that we have just done. And it is derived by assigning a score between a 0 and a 2 for each potential patient vital. So it means a higher score suggests a higher urgency. For example, greater than 7 TUs points will give an emergency status. 5 to 6 points will give us very urgent. 3 to 4 points will give us urgent. 0 to 2 points will give us routine care. So you'll find for our patient, it has already categorized for us a TU score of 1, which is routine care. And now the TUs category will be already auto-picked by the system as routine. So if we have any triage notes at this point, we can be able to say maybe patient has no complaints. They had come for, or patient is seeking testing services. And we can be able to save and close that particular form. So when we do that, the system will give us a successful message showing that the form has been submitted successfully. And you'll now notice from the patient homepage where we had no information for vitals and anthropometrics, now we have specific details and vitals history that are being taken today at this particular time. And we can be able to tell some of the statistics that we have captured for blood pressure, heart rate, respiratory rate, oxygen levels, temperature, weight and height, and even BMI categorization. Now, for this particular patient now, who is just coming for HTS services, and we are done as the person who was triaging them, we'll be able to assign them to the next queue so that they can be provided for the next particular service. So for this instance, I'm going to send them to OPD clinical consultation room 2, where HIV services are being offered so that they can be tested for HIV. Then I will assign them to the next queue. So when our provider who is offering testing services goes to their room, that is from consultation room 2, they will be able to identify their patients, and they can be able now to offer them specific services. A minute, I confirm why my patient is not in the room. So my patient is still currently on OPD, and we need to queue them for testing services. So I'm going to queue in clinical consultation OPD room 1 and assign them to the queue. The system will tell me they have been transitioned successfully. So when the person now who is offering testing services, who is in consultation room 2, room 1, they will be able to find our patient among the queue, and they will also be able to tell the patient name, the queue number, where they're coming from, the priority level of that patient, so they know whom to prioritize, any comments that have been received, any status. Currently all the patients are waiting and the queue, and even for how long they've been waiting. Then on top, they will also be able to get some statistics. For example, we can see we have 3 patients who are waiting consultation, and their category currently, according to the TU's categorization, 1 of them is an emergency case and 2 are not very urgent. So our case now is to offer now testing services to this 1 patient who is an emergency case. PrEP does the training is the name of our patient. Again, from the far end, we will be able to call in our patient so that we can be able to offer them services through the system. When you do that, again, the system will expect you to confirm your patient and proceed to serve, so that now this particular user, who is a HTS testing counselor in this particular room, will be able now to access the patient homepage so that we can now proceed to offer the particular services. So our interest is to test our patient. So we will go to the clinical forms and see what forms are available. We will be able to say we have a HIV self-test form that is available, HTS eligibility screening form, initial form, a retest form. So for us to determine first whether our patient is eligible for testing, we are going to use the HTS eligibility screening form to determine if our patient is eligible for a HIV test or not. So once we select the HTS eligibility screening form, it provides for us the particular form. Again, the visit details will auto-pick automatically by the system, the date we are performing this particular eligibility screening, the provider who is performing it, and the location. And now we can proceed to fill in the actual details of the form. So what population is our patient? We can say our patient is a general population client. Do they have any disability? Again, it can either be a yes or no. If we say yes, we need to specify what particular disability. In my case, I'll say my patient is visually impaired. Then the department coverage where we are doing this, maybe this is from outpatient department. Again, we need to define the patient type. Remember, this is not a hospital patient. It's just a patient who is a non-hospital patient, maybe who was coming in for a test, so we can maybe select non-patient. And then we can proceed. Is this client healthcare worker? We can say no. Again, we say yes if this particular client was a healthcare worker in this particular facility. For this instance, we're going to say no. Then does the client have any relationship with an index client? Again, we can be able to define what type of a relationship was it. Is it a sexual contact relationship, social contact, needle sharing, if at all they have any relationship with the index client. If none, we can just select none. Then the HTS strategy that we're going to use, for this one, we're going to select NP, non-hospital patient for non-hospital patients. Then the HTS entry points, again, we found our patient from OPD. Then we proceed to the history of HIV testing. Has our patient been tested before? Again, it can be a yes. If yes, then we'll need now to determine who performed that particular test. Was it a HTS provider or was it a self-test? For this instance, we're going to select no. Then we proceed now to the risk assessment questions. Has the client ever had sex? We can say yes. Is the client sexually active? We can say yes. Has the client had a new sexual partner within the last 3 months? We can say yes. And again, we need now to determine what was the partner HIV status. Maybe the client does not know, so we can select unknown. Then, have you engaged yourself in unprotected sex with more than one sexual partner in the last 12 months? They can say yes, or they can say no. If we select yes, then we need to determine how many sexual partners there have been. We can say 1. Then, does the client engage in sex under the influence of alcohol or drugs? For this instance, we're going to say sometimes. Then, have you ever had unprotected sex in exchange for money or other material gains? Maybe your client says no. Have you recently had any incidents of condom burst? Our client can decline to answer. They will not give you an answer. Then, have you engaged in unprotected sex with someone you don't know their HIV status within the last 12 months? Again, they may decline to answer, or they can answer a yes or a no. Then, have you had unprotected sex with someone who has known HIV status? Again, they may also decline to answer. Then have you had any traditional and medical procedures, e.g. circumcision, plastic tooth extraction, and the like? They can say no or yes. Then we also need now to go to the section where we need to screen for any violence that may have been meted to our patient or client. Has the client recently experienced violence? If we say yes, then the system is going to follow up with other questions to determine what type of violence it was. So if we say yes, select yes. Within the last 3 months, has the client experienced either physical or sexual violence? Maybe you can say yes. Have you recently been forced to participate in a sexual activity against your wish? They can say no. Then we'll proceed to preventive care assessment, whether they have had any PrEP services. If the clients are currently on PrEP, we can say yes or no, or they can also decline to answer. For PrEP services, again, we can say no. STI service, we can say maybe yes. Then we proceed to TB risk assessment. Has the client been screened for TB? We can say yes. Then when proceed now to screen for TB so that we can confirm through the questions. Have the client had any cough of any duration? They may say no. Client has had a fever? No. Experienced any noticeable loss of weight or poor weight gain? They can say yes. Then the client experienced any night sweats? They can say no. So if we get a yes for any of the TB screening questions, then the resulting TB status is going to be the patient is presumed to have TB, and maybe we can now send them for clinical consultation and further tests to confirm that. Then because again our patient is said is a pregnant female of reproductive age, we will get a pop-up of pregnancy and no. Is the client a breastfeeding mother? We can say yes, they are a breastfeeding mother. And now we can proceed for eligibility and referral for testing, whether our client is eligible for testing. Now from the questions that we have answered all the way from the risk assessment questions, the sexual history, we can be able to tell that our client is eligible for testing, yes. And we would also want to confirm this with a HIV risk category. So this Get HIV risk category is us invoking a machine learning model that has been trained to find patterns in patient demographic data so that it can be able to help us to make predictions of how likely a patient will turn HIV positive if a HIV test is administered. So this particular machine learning model helps us to assist providers to identify and test HIV risk patients for HTS, and also to be able to automate the HIS risk certification, whereby now we can be able to tell even for a patient, the machine learning model has categorized our patient as having a high risk score, showing that this client has a high probability of getting a HIV positive test result, and testing is strongly recommended. So the model uses people, place, and time factors such as demographic factors, age, patient source, TB screening results, population type, behavioral risk factors like we have just seen above, demographic distribution of a particular place where the patient is coming from, prevalence of HIV and sexual behavior information, history of HIV testing, population estimates, prevalence, multiple partners, previous STI cases, condom and the like. So it does not just look at the data that we have here for that model to be able to do the categorization and risk stratification, but it also looks at all these other things that I have mentioned. So the system again will also be able to categorize the particular risk category, which has categorized as high, and we can proceed. Now, again, our provider who is performing this screening will need to confirm if they are recommending for HIV test, and we can say yes. And now we need to confirm the reason as to why we are recommending this HIV test is either because healthcare worker provided discretion based on the screening findings, or this particular client deserves to have a HIV test done. So for instance, we're going to say the reason why test is
Hi, Miriam. Songo, can you hear Miriam? We've lost her.
No, she's breaking. Marianne, you're breaking. We can't hear you. Yeah, she seems to have dropped.
Songok, she's rejoining in a few.
Yeah, let's let Marianne a few minutes to rejoin. I guess she has challenges with the network. Otieno.
Ameenda wapi huyu?
Mike, I think ako na challenges ya network, tumpe time kidogo.
Ni sawa, okay.
Otieno, can we have someone step in for Marianne? I think we also have challenges with our connection in terms of the numbers, because it seems like our link can only accommodate up to 500. I don't know that. Yeah, but I think Marianne should be able to join because we are 488. But Otieno, do we have someone who can step in meanwhile? Because it seems like Ama Otieno pia
She's joining in a moment. Let's just give her like 1 minute or two.
Okay.
Please, for that, confirm you can be able to hear me as I reshare my screen.
Yes, we can hear you, Marianne. Reshare your screen.
Okay. So allow me to quickly just fill this so that we can be able to save. So once the HTS eligibility screening form saves, our patient now can be sent for further testing, and we can start with the HTS initial form to test our patient. So for this, once we open the form, we're going to go through the HTS testing using the 3-tier testing algorithm. So for our first patients, determine again the population type, general population. Does client have any disability? We're going to say yes, which was visual impairment. And we can be able to even specify what it was. If you select others, then HIV testing history. Has the client ever been tested for HIV by HTS provider? We can say no, this is the first time they're being tested. Has the client done HIV self-test within the last 12 months? We can say no. The setting, is the client willing to share results? We can say yes. No. Client has done a self-testing test, we say no. Then the setting where this is taking place is in a facility. The HTS approach being taken is client-initiated testing. They had come purposefully for a HTS test. The HTS strategy that we're using is going to be still NP for non-patients. HTS entry point, we got our patient from OPD, and TB screening has been done, and we realized our patient may be suspected or presumed to have TB. Has patient consented for a HIV test? We can say yes, and now proceed to testing. How are we testing our patient? We're testing them as an individual, and we can start with the first test kit within the OPD or the HTS lab. We can say you can use train screen. Select a lot number for that. Expiry dates for the test kit, we can push it 2027 December. The results for this patient, we can say the first test kit using a train screen testing on a 2:3 ratio, 2 drops of blood, 3 drops of buffer, waiting for 15 minutes. The result is going to be a negative HIV test. So when we get a past HIV test as negative, the final results also is going to populate as negative. Then have the results been given to the client? We're going to say yes. Couple disconduct, it is not going to be applicable because our patient was being tested as an individual. Then are we going to refer our patient to any other service? We can say yes, we want to refer them for preventive services because we had gotten a high machine learning risk score, even depending on the questions that we had answered for sexual behavior for our patient. And now we may want to refer them for risk reduction counseling, condom use counseling, post-exposure prophylaxis, prevention of STIs and treatment, depending on how the patient is presenting. So for us, we're going to say, we are going to refer our patient for risk reduction counseling, prevention and treatment of STIs and PrEP exposure, prophylaxis, and we can also have a few remarks where possible and save and close that particular form. So at this point, we're going to refer our patient for prevention services so that they can be able to receive those particular prevention services that we have been able to refer them to. And that ends the cascade for that so that we can now send our patient for PrEP. Now, in case we have a different scenario where our patient is coming in tested using the 3-tier testing, I'm going to select another patient for this. For this one, I'm just going to highlight a patient now who is coming, who has been tested by the first tester and confirmed as HIV positive, again retested by a second tester using still the 3-tier algorithm, and they have been found to be HIV positive, and they have been sent to the clinical consultation for linkage. So this is the particular patient we are going to use for that scenario. So once the patient comes in, from the clinical encounter or the visits, we can be able to tell our patient came in today, they were tested, they were screened for HTS eligibility screening, and they were found to be eligible for testing. An initial HTS form was administered by the first tester who took the patient through testing, and they found them to be HIV positive. They referred them for confirmatory testing to a second tester, and a HTS retesting form was filled. Again, the results were confirmed as HIV positive. And now we want to link our patient to HIV care. So to do that, the system allows us, one, to be able to fill a HTS linkage form so that we can refer our patient for HIV care services. The visit details are going to auto-populate, and then we'll be able to fill the linkage details. Where are we referring our patient? This patient is being referred to this health facility, and the facility will auto-populate the name. Then we need to give our patient a CCC number. I'm going to use this CCC number, maybe 34992. Then we need to determine the healthcare worker the patient has been handed to. We can say Mary. Ada, we can say maybe they are an adherence counselor. Date enrolled, we can just select today. And maybe this will also be the date where we're initiating our patient on ART. And we can be able to give some few remarks. Client, recommended, or client enrolled in this facility for HIV care. And you can save and close the form. So when you do that, we have finished the entire HTS testing cascade, and for this particular patient, we found out that we have tested them HIV positive. So how do we manage them for HIV care within the system? So once a patient is identified to be HIV positive, we need to enroll them to the HIV program, and this is found from the patient summary. We select care panel, where we'll be able to find any program our patient has been enrolled to, or we can be able to enroll them to a particular program. So program enrollment, a patient can be enrolled according to eligibility criteria to any program, and this is based on the age of our patient, the gender, presenting symptoms, and even existing or confirmed conditions. So you may be able to find there are specific programs that male and female clients will be available for specific gender, available for specific age, again available by presenting complaints, and available by confirmed conditions. So a patient is eligible for HIV program enrollment, and we're going to enroll them for that using the enroll button that will give us the HIV enrollment form. And we'll be able to see the visit date that we're enrolling our patient, the provider who is doing that, the location, and we can be able to save and close that form. And when we do that, we'll find that our patient currently now has an enrolled status for HIV program. So when we go back to the panel summary, now we'll be able to see our patient has been enrolled to HIV. And from this point, we can be able to see some statistics for HIV enrollment. Their current status. For example, right now, they have never been on ARVs, so we can also be able to provide ARVs when they start using the edit button for regimen. We can be able to start them on a particular regimen, starting them for this day using a standard regimen, select the regimen line, maybe it's an adult first line, and select the regimen itself. For this particular instance, we're going to select TDF3TCBTG and we can save. And now we'll find our patient now has been started on a particular regimen. Now, for us to be able to offer services to these patients and to manage their care and document them, the clinician or the clinical team will be able to access the clinical forms and access now the particular forms for managing our patient, for example, the HIV green card and all the other screening forms, ART preparatory forms, screening forms that will be available on request or when they are due. For example, screening for cervical cancer, for PHQ, depression screening, and the likes. Then again, during care and management, our users may also want to have specific notes when they are managing our patients. They'll be able to use the icon for additional notes so that you can be able to tell for each primary diagnosis that maybe our patient has. For this instance, our patient is HIV positive. They may also have another secondary diagnosis. They may have some infection. We can say maybe HIV bacterial staging infection. We can be able now to note particular treatment plans for the diagnosis and even the management using now this other.
Marianne, allow me to interject. You may need to move a bit faster because of time, kindly, Marianne.
Okay, I'm almost finishing up using the visit notes. Then during the care and management, when we either want to confirm the diagnosis, we will be able to perform particular investigative functions using the order basket, where a clinician now will be able to order for a lab test, order for an imaging test, even order for a particular procedure using this particular section, and also be able to give or manage our patient using drugs by adding these particular forms so that you can be able to load the drugs, load the drug orders, which will be shown within this particular next session. So that ends the section for clinical management for our patient, either one who is tested HIV negative or one who is tested HIV positive. For this instance and for this case, our concern will be more for now the prevention measures we're going to take for the patient whom we identified as HIV negative. Now, to quickly highlight the other sections for this particular training, I'm going to invite Moses. Moses, if you can hear me, you can proceed.
Yeah, thank you, Marianne. As Moses is preparing to share his screen, one quick announcement. We apologize. We noticed that the link we're using could only accommodate 500 packs. So we've shared a link on the wall, a YouTube link. So kindly share with the rest of the other colleagues. They can also be able to follow our training, and we sincerely apologize for that inconvenience. So Moses, take it up.
Thank you, Songok, and good afternoon, everyone. Please, Songok, confirm that you can hear me.
Yeah, loud and clear, and I can see your screen. Proceed.
Thank you. I'll want, in the interest of time, just to be brief. So my interest here today will be to just build up on what Otieno and Marianne have already, on the foundation that has been laid by my two colleagues who preceded me. So, but my focus will be just to try and induct everyone who hasn't probably had the opportunity to interact with the new version of TaifaCare, the DHA version, just on how to navigate. I mean, the lab orders, and also if we are having any lab personnel in the call, how they'll be able to just update their results. So I should be done in about 4.5 minutes, and I'll really want to be brief. So I want again to ride on the patient that Marianne had started working on. So I'll come to my EMR and then just search for Thursday. So assuming that I'm that clinician again, I want to make just to place an order for this particular patient. Thursday. So Thursday training, Thursday prep training. Sorry, I've gotten the one with an active visit. All right. So because they already have an active visit, I'll not need to check them in. But by and large now, assuming that I want to probably place an order, one thing that I'll want all of us to note is that with the new release, there has been some change. Those who are probably utilizing 19.22 and previous versions, as much as you're probably on 3.x, you realize that the workflow for this particular version we've really tried to streamline it just to reflect your operations at any given healthcare facility. And that's the reason why, things such as the queue manager had to be dropped in favor of, just the workflow that suits a normal and a typical patient flow. So having said that, I'm sure the patient that Marianne was working on is still probably in the clinical, one of the clinical encounter. Sorry, I've already picked them. So I'm sure they're still in from the queue. I can see they are still actually on OPD, actually in OPD consultation room 1. So as a clinician, what can I do to just offer probably if in the event I'll need to request for any investigation for them, especially from lab. So the diagnostic feature has been disaggregated just to have lab orders and radiology and imaging as separate, as opposed to what you used to have. All of them were in the initial versions had been lumped under diagnostics. So for my case, I'll just come to lab orders, and when you click on lab orders, like Otieno again had alluded, if there were any tests that had been done for this particular patient, you'll see them under the orders. If there were any orders that had been requested, you'll see them under orders. So there's this tab called orders. And then if there are any results that have been filled over, have been provided by the lab team over time, again, all the results will appear here. The reason why this was done, the reason why this was changed to, look like this is so that, to just improve on the availability of tests. We all understand that it's very critical in healthcare to avail as much information, even if it is historical, and to the users, bearing in mind that we are now living at an age where the EMR is no longer a health record officer tool, but a tool that is used by the healthcare worker. So for that purpose, now that there's no result or orders for me, how do I create orders? So when you click on the orders tab again, I'm still able to click and order for my lab test from the record orders feature, as you can see where my cursor is, or still from the traditional, allow me to just close this. Traditionally, we were used to the order basket. So the order basket is still there, but probably it's just a matter of time before this will be retired, because to try and just do away with the redundancies. So, but for now, you can still use both options. But the change here is that the record orders has been added as one of the features just within the patient profile. And once you do that, it actually just gives you the same panel like it were for you to be able to order your test. For example, I'll want to just order a test here, a full blood count for my patient, a complete blood count, and then I just click on the order form. Again, if for that particular test, a price, or probably it has been configured as one of the tests that a patient is supposed to pay for, a price for the test will populate. And again, as you can see, the price is actually dependent on the payment mode again, because you understand that facilities probably charge differently when a patient probably is paying out of pocket as compared to when they have to make a claim from an insurer. So yeah, that is one of the features that have also been included in the EMR. So I'll just pick this and say save order, and then sign and close. So when you click on sign and close, you'll get the message that a placed order for complete blood count has been successful. Again, in the event I'll want, let me just try and pick an order that probably is not one that I'm supposed to be billed for. So I'll come and say I want to also test this patient for VDRL. So order form. sorry, now VDRL also is a test that is being billed for. Allow me to choose one that is probably does not have a price, and I'll explain this later. Just the alkaline phosphate, ALP. Yeah, as you can see, no price has been configured for this service. So that means that, for this particular test, you remember that the EMR comes as a blank slate. So it is up to facilities to configure the different prices for the different tests, and even billable services, including both pharmaceuticals and nanopharmaceuticals. So I'll place the order and just sign and close. Now, after you place your order, if you are to allow me to just refresh, and then we go back to this particular patient's page. So Thursday. Sorry, it's taking too long to load from my end, but I mean, sometimes connectivity issues, you realize that the server is not, it's actually hosted somewhere. All right, so I'll come there and just choose my patient. So when I go back to lab orders, you'll see that, I mean, the two orders now, even when I just click on, when we get to the patient profile, you'll be able to see the two orders that have been placed for this patient. So there's the alkaline phosphate, ALP, and there's a complete blood count. So by a clinician doing this, actually the two orders have already gone to the pharmacy, to the lab, and now it's up to the lab personnel to probably attend now and ensure that they process the orders based on the availability of the sample, if the sample will be availed, and also based on the fact if probably the test has to be paid for, based also on the ability of the patient to pay for that particular test. So how do we do that? Now, assuming that I'm a lab personnel, so the lab personnel, what they'll see, again, for my user credentials have been, I have some super user rights, so I'm able to both act as a clinician and also as a lab personnel. So, but in your facilities, I hope you all remember Otieno mentioned that access to any feature is actually role-based. So you might not be able to do what I'm doing as a lab personnel because you'll only be restricted to filling in and receiving labs and processing the labs. But now for me, the reason why I'm able to just toggle between being a clinician and being able to attend to a lab is because I've assigned myself all the rights. So I'm assuming that I've logged in as a lab personnel. Again, this is the landing page, and as you can see, this is the dashboard for the facility with the facility homepage. I'll come down to the left navigation panel this time around. This is the facility left navigation panel, and just drill down to laboratory. When I click on laboratory, I think Otieno had also mentioned this. I mean, it takes me to the laboratory dashboard for that particular day. And then by default, again, the EMR has been designed to just zero you down to that particular day. But this doesn't mean that you can't flex with the date range. Yeah? As you can see, there's a date range feature here. So if you want to probably to view more than today's activities, you can just play around with the date range. But I mean, you can decide to go even up to the beginning of the month by clicking on the date helper here, and then you just play around with it. I'm sure most of us are aware of that. But now, allow me to also address the figures that are appearing on the dashboard. One, the first figure that we are seeing is for tests ordered. So this represents the tests that have been ordered on that particular day. Or in the event you flexed with your with the date filter, it will for all the tests that your date range, accommodates. And then now there's also statistics on the work list. So the work list actually just gives you the number of lab tests that are being worked on by the lab personnel at that point in time. So out of the 26, how many are in progress? So so according to this, there are only 3 that have already been picked. And then now also gives you the results completed I will give you a total number of all the results that have been processed fully, and the results are uploaded to the patient profiles. So allow me to quickly again just take you through the test order. So once you come to the test orders, from still the laboratory dashboard, you will be, it has also again been divided into 4 tabs, as was explained by Otieno. So the tests ordered, again, for those tests that have just been ordered. So for example, for my patient prep Thursday training, as you can see, is appearing as part of the the tests that have been ordered. And if I want to attend to them, what do I do? The arrows that are facing downward on the left of your screen, just actually they are navigation buttons to help you expand and just collapse and expand a particular patient's test. So when I click on on the arrow, it expands and gives me a list of all the laboratory orders that have been made. And the reason why I did 2 laboratory orders, and as you can see, there are the 2 laboratory orders that I made for my patient are all appearing here. There's one, the alkaline phosphate, the ALP, on the top, because it's the one that I ordered last. And then the complete blood count, the one I ordered first, is appearing at the bottom. Again, if you are to look at the buttons and the features, the navigation features that are appearing under each, you will see that you know that they're slightly different. Under the complete blood count, we have the option to either reject the lab request or bill. And the reason why this is so is because for all the lab requests or lab orders that are supposed to be paid for, unless they are being paid, unless at the point of the patient being checked in, it was clearly stated that they will be taken care of, their payments will be taken care of by an insurance such as SHA and probably any other registered insurance provider in the system. You are supposed to be able to, you cannot navigate further and probably as a lab personnel and pick that particular test without that bill having been settled. I think this is just standard practice, and I mean the feature has been put in there so that we can avoid cases where facilities are crying wolf that they offer tests and then patients were unable to pay. I'm sure it's standard practice amongst a majority of the facilities that for cash paying patients, they have to pay first before a service is offered. But again, even in the event this patient again was inpatient, this rule will relax. So the bill, you can still process you can still pick the lab request and process it. Why? Because the system assumes that the bill will be settled at the point of the patient getting discharged. But now, for purposes of this, and the reason why I picked 2 tests is just for us to be able to utilize one to be able to see how do we process this. So, as a lab personnel, I'll want to utilize the ALP test for purposes of showcasing how laboratory orders are processed. So, when I click on Pick Lab Request, I'll be prompted to confirm that is indeed what I want to do. And as you can see, there's a message that pops up saying that continuing will update the request status to in progress. So that means they'll move from ordered to in progress. So I say yes, I confirm that. So once I confirm that, and I click on the in progress tab, you can see that the test has already been aligned here, and it's one of the tests that is available now for me to service. Assuming that I've gotten the necessary samples, you can see now the features that are available for me under this particular panel are either for me to reject the lab request. And the reason why a lab request can be rejected at this point in time is probably because either the sample was insufficient or due to one reason or the other. Probably even we have had a breakdown in the machine that is doing this. But we're also given the option now to just add the lab result. So as a lab personnel, this is where you will go to and just click on add, and then probably just give the necessary results and the save and close. So that will save that particular lab results. And after saving, that particular lab order now transitions to completed. And as you can see again now, prep Thursday training is appearing under the completed tab, and with the results actually that I keyed in. So by and large, that is how to process, how to go through the ordering of lab requests and processing of the orders. The declined tests tab is just for all those lab orders that have been declined, like I mentioned, and I'm sure I'm just repeating what Otieno also mentioned. But one other thing that I want to point out is that even as we work on this, there's we are working on ensuring collaboration between the EMR and the lab machines through labware. So yeah, it's there are some facilities that are already utilizing this, but we are hoping that I'm sure that has been a pain point, especially for a majority of our users. A test like a full blood count, which has a lot of parameters, there's a need for us to ensure that we really try and minimize the action of lab personnel entering the results one by one. So I'll pause there and hand over the mic to my brother Eric, just to proceed with the rest of this session. Allow me to stop sharing. Songok, was I audible?
Yes.
Yes, you are, Moses.
Okay.
Thank you, Moses, for that. I think I thought Ogutu could go next after you. Ogutu,
Oh, sorry, yeah, it should be Ogutu then.
That's fine. Let me share my screen. Mine will be a short one. Are you able to see my screen?
Yes, Ogutu, your screen is up.
Thank you. I'll just showcase which looks like an overview or a recap on what Bernard Otieno had already shared when he was doing the navigation. So for me, I'll just take us through on how to do drug orders and dispensing by the pharmacists. So I'll just pick on the active patient, that is prep test training, and as already alluded earlier by both Otieno and Moses, for us to do orders for drugs. The order basket is what will be used. It is for both drug orders, lab orders. You can do imaging procedures and also medical supplies orders. So for us to do a drug order for any patient, that is where to go to. And for us to do any drug order, you just go to drugs, click on add button, then you search for the drug that you want to prescribe for this particular client. I'll use an example. Let me see. Okay, let me pick rifapentine isoniazid. This is just for demo purposes. Okay, so you click on the order form. From the order form, you'll be able to get at a glance the amount of stock you have for this particular drug. If in any case the drug is out of stock, you'll be notified under in stock. It will be in red, a drug out of stock. So for the providers, I always take note of this. And if in any case there's a drug you'd want to prescribe and it's out of stock, kindly liaise with the pharmacy so that they can update the drug if it's available in store. Or they can, or if the system issue, it can be also sorted. So for the drugs that are available in the pharmacies, all the pharmacies within the facility, they'll be able to tell you the stock, the number of tablets, or the number of packs or bottles will be shown here so that you know what you have while doing the prescription. So an example, just do a prescription for this particular client. Those, let me just pick two at random. This will be tablets. The route is oral. We'll have the frequency twice daily. So this would be around duration is 5 days. Number of tablets, let me just have it at 20. Refills done. This is TB. Then you just save order. Is 0. There are no prescription refills. So when you sign and close, when you come to so I think that is how to do drug orders. And after doing the order, the client should be able to go to the pharmacy to get the prescription. So I already have a user that has got the rights. So I will switch to a pharmacist and access at the dispensing module to dispense the drug. So I will change location as a pharmacist. After logging in, you just change location or select while logging in. I will change to main store. As you are aware, TaifaCare, powered by OpenMRS, is role-based. So depending on your role, to be able to access various modules or features. So I will head directly to dispensing app. So here I'm at the pharmacy. So by default, you'll have the tab on active prescription loaded for you. So from here, you'll be able to see all the active prescriptions that have not been serviced. At a glance, if the list is so huge, you can search for the client. For me, I can see my client is here. Prep Thursday, which I've just ordered, rifapentine. So all the active orders will be listed here. And we also have all prescriptions tab, which will show you all the prescriptions that have been done, those that are active and those have been completed. The completed one are the ones that have been serviced or dispensed. So if you want to dispense the drugs that are ordered for Prep Thursday, when you click on the down arrow, you'll be able to get the drug. You'll get the quantity that are ordered. From this particular section, you can pause the prescription if any case you'd want to get more information on the drug or you want to consult something before you dispense the drug, or you can modify the drug because of one reason or the other as a pharmacist. So other than that, you can directly go to dispense and then you dispense the drug depending on the quantity that is available and that you can prescribe. So we have enough drugs. We'll do the 20 tablets that had been ordered. And then I select from where. This is the batch that I'm dispensing from. So I'll just select that and dispense the prescription. Correct. So my client will move from active prescription to all prescriptions. Will search for the client here. Will be able to see that this particular prescription has been completed successfully. I think that is all from my end, unless there are any questions or clarifications needed. Thank you. I'll stop sharing the screen and hand over to Eric Mudomo.
Thank you, Ogutu, for taking us through the prescription and even the dispensing. Confirm that Ogutu can hear me.
Loud and clear.
Let me share. So again, I'll go to confirm that you can be able to see my screen.
Yes.
Thank you. My name is Amudomi Eric, a business analyst at Palladium. I'll be taking you through now how to walk through the prep module. Now that you've been taken through the registration of a client or even a patient, having walked through the HTS section, so I go direct to the prep module. I know this is what will be happening once we receive Lenacapavir at our facility starting from next week, as Dr. Barbara alluded earlier when she was giving her speech. So maybe something to note, I'll start with under the consultation queues. Marianne talked about this, so I don't want to go through about it again. And looking at the consultation room number 2 will allow me to use the same client, that is the prep, that's the training. Why will I be using the same client? This is because for you to even enroll a client into prep module, there are some of the things that you need first, or the client needs to meet, even for you to be able to enroll, making this particular client to be eligible. One, the age of this particular client, and allow me as I talk to call and serve this particular patient. One is the age that we need to look at, must be equal to or above to 15 years. Number 2, we need to look at the weight, must be above 30 kgs. You can be able to see when triage was done, this is 32 kgs, the age is 26 years. Then number 3, the testing should have been done, and that should be HIV negative. And when Marianne was doing this, we could be able to tell the testing turned to be HIV negative. And then from there, now I can be able to start. Maybe to mention, when you look under the care panel, we were taken through this and told that under the program enrollments. So from here, there's where you can be able to get the prep program, and then we can be able to enroll. But now we can't be able to find it. Why? Because this particular client has only met the 3 criteria aspects that I've talked about. So we need now to go for the 4th one, which is whether the client is willing to take prep. And how do I go about it? I'll navigate to the clinical forms. Then from here, we'll be able to see the prep behavior risk assessment form. This form will only appear after you've done the HIV testing, the HIV initial testing, and this particular client turned HIV negative and meets the other criteria. So when I click on this form, I'll be able to fill it, focusing on the behavior risk assessment of this particular client, whether the sex partner HIV status is known, is it positive, negative, or unknown. And for example, if I say unknown, there are some of the things that, depending on how even the healthcare providers at the facility have been taught using the guidelines, they'll be able to tell some of the things that make this particular client to be at risk of even getting HIV, hence need to get PrEP to prevent this happening. Then the other is the behavior risk of partner. You can be able to select that will be able apply to this particular client. Maybe has sex with more than one partner or the transactional sex, and you can be able to select all that applies. Then is this particular client receiving any contraceptive? Can be either yes or no. And then assessment outcome, depending on how you've assessed, because you've been attending to this particular client, then you can be able to tell whether is this particular client at risk or is this maybe risk low. So then allow me to say risk, and then was there any risk education that was offered? If there was any, then you can be able to specify that. And then this is a mandatory question, whether the client willing to take PrEP. We'll notice that if you say no, you need to give the reason as to why, and then you can be able to proceed and save the form, but you will not be able to see the program, the PrEP program appearing here. So you need to give that the client is willing to take PrEP to make it now the 4th aspect of ensuring that now this particular client is eligible for PrEP. Then if there is any other preventive service that you want to refer this particular client, then you can be able to pick. Maybe, for example, prevention and treatment of STIs and even counseling on the risk reduction. Then from there, you can be able to save and close that. Once that is done, then we'll now navigate to the same program enrollment and be able now to start enrolling into the PrEP program. Just a minute. So when I get to the care panel and then program enrollment, at the bottom, then you'll be able now to see PrEP program appearing. That means now the system can be able to validate all the aspects have been met, and then this particular client is eligible. So when I click on the enroll, you'll be able to see the PrEP enrollment form. Again, this is coming as a different way of how we've been doing our PrEP initially. And this is because we've noticed in most of the setups, as we even be moving to the facility-wide system, some of these enrollments are done even by non-clinical personnel who may not be able to respond to some of the clinical variables that we've been including in our enrollment forms. So that's the reason as we'll be able to see at this particular moment, it just only clicking on the save and close, which will now put or place this particular client under the PrEP enrollment program. So what happens when this particular client gets into the next provider, who may even be able to record even the clinical sections, can navigate to the options or the three dots. And when you click on these, you'll be able to see the forms. So where we have all the programs, not only even the PrEP program, you'll be able to see the forms will be accessed from this particular section under the program enrollment, unlike from the clinical forms. So I know we'll be retiring all these forms from the clinical forms, but you can be able to access them from the program enrollment. So from here, you can be able to see the PrEP initiation. And when you click on the PrEP initiation, then this is the form that I can be able to proceed and give the client type. Is it new transfer in or a restart? And depending on what I select, then the form has been validated. If this is a transfer in patient, then you'll be able to see more variables pertaining to transfer status being availed. But allow me to say new client. Then we have the even the restart for those who may be restarting PrEP. Maybe they interrupted at some point. Then they are coming back to restart. Then you have the population type, either general population or the key and vulnerable population. Then we need to give the unique PrEP number now at this particular moment. And the system will be able to validate if you enter an invalid number, and will be able to warn you. Then we have the PrEP initiation details, whether the client has previously been on PrEP. So if you say yes, and I need to mention here, then you'll be able to see type of PrEP. This is one of the enhancements that we've done by adding the Lenacapavir, which is now the new drug that is coming in, or the type of a PrEP that is coming in has been added. But if it is for the first time, this particular client hasn't ever used this, you can be able to say no, and you can be able to include the adherence body by clicking on the add. Then you can be able to give the name, then the alias if this particular client has, then the relationship to this particular client, maybe spouse, and then even the telephone number we can be able to give, and the alternative phone number. Then from there, you can be able to save and close. By that, we'll now have started the PrEP initiation process. Then when you navigate back to this particular section again, you'll be able to see now us getting the PrEP initial form. We need to differentiate between the PrEP initiation and the PrEP initial form. The PrEP initial form now carries what now the clinical team, the clinicians feel for the first visit when they are attending to this particular client. The PrEP initiation, it carries more of the details which will be filled by the person who will be completing the enrollment and giving you the unique identifier and getting you now fully into the PrEP module. So when I click on the PrEP initial form, you'll be able to see the visit details, then the partner profile, whether the partner HIV, whether the partner is HIV positive, which is a yes or no. If yes, then you can give the HIV positive partner profile, but earlier indicated that was no. Then we get to the STI screening. Has this been done? If yes, then you can be able to select all that apply. And this is the outcome of the STI. Maybe there was a genital ulcer disease that was noticed. Then from there, and you can be able to select more than one. Then If it's other, then you can be able to specify. For the one that you tick, then was it treated? Yes or no? And there is not any other follow-up question. From there, we get to the fertility intentions, and this is because our client is a female. So if this was a male, you'll not be able to see some of these variables in the form because the system has been validated. So for the menopausal status, if I click, let's say, for example, it's menopausal, there are some of the things that will be hidden and you'll not be able to respond to that. But if not, then we need to look at when was your LMP and whether the client is pregnant. So give no, but if it was yes, then you'll be able to see some of the variables coming up here for you to be able to fill the EDD, whether the pregnancy was planned. But if it was no, you go direct to whether you're planning to get pregnant. Again, can be either yes or no. And if at the moment you are breastfeeding, maybe yes or no, let me pick yes, then you get now to the family planning status, whereby if you're not using, you'll notice nothing happens. But if on family planning, you need to specify the method. And again, for the same, for if you want family planning, you need to specify the method that you want to start using. Then we have the other part of the adverse drug reactions. Is the client has adverse drug reactions? If you say yes, then you'll need to click on the add here, and then you can be able to give the medicine that is causing the reaction. We have a list from there. Then the reaction itself, we have options to select from. Then the severity, again, options to select, and then the date of onset and the action that was taken. If there wasn't, then at this particular point, you don't need to add, but to say that there was not any adverse drug reaction. Getting to the lab investigation section. So this is just to confirm whether was serum creatinine done. If you'll be doing it, then you can be able to say yes. You will navigate to the order basket and be able to order what Moses was showing us. Then we have the PrEP status from here, whereby you're looking at the signs and symptoms of acute HIV. Remember, above the 4 that I mentioned, there are some of the things that are looked at for you to be able even to proceed initiating on PrEP. On PrEP. So signs and symptoms of acute HIV, this is either yes or no. And you'll notice that when I say yes, automatically the system discontinues the starting of PrEP, because if there was any signs and symptoms of acute HIV according to the guidelines, you're supposed to probe further and first stop initiating PrEP. But I'll say no so that I can be able to proceed. And whether adherence counseling was done and the outcome. Then was there any contraindication for PrEP? Again, from here, when you say the same confirmed HIV positive, or you give a renal impairment or less than 30 kgs, the system will alert that the PrEP treatment plan will be discontinued, that you cannot proceed. So allow me to say none, and then give the PrEP treatment plan as start. So here you can be able to state whether you are starting, and we'll only be able to see start because it is at the initial. For the other forms, you'll be able to see, you'll be able now to see continue, restart, switch, or discontinue. So at the start, then you'll be able to say the reason for starting PrEP. And then you'll be able to see a list. You can be able to select depending on what this particular client presented with. Then the prescribed PrEP today. When you say no, you'll notice there's nothing that will pop up. But when you say yes, some more question now will be able to show up. This is another enhancement that we've done to this particular form. For those who've ever used it earlier, we've now included the dosing strategy, and the dosing strategy will include daily oral PrEP and the long-acting PrEP. And this is for the female. If my client was a male, you'll be able to see event-driven being one of the dosing strategy. So the system is again validated. That's the reason as to why I can only be able to see the two. That is the daily oral PrEP and the long-acting PrEP. And if I pick daily oral PrEP, I need to give the type of PrEP. We've aligned these as per the guidance. So when I click on the oral, you'll be able to see the regimen that I need to prescribe. It says TDF, TTC, TAF, FTC. Now again that we're bringing in here, and then the TDF, FTC. So this will be able to align depending with the client that you are working on. If this client was a male, you'll be able to see difference here with only TDF and TDF3TC and TDF-FTC appearing. So the system has been validated. But allow me to talk on the long-acting PrEP, because this is now what we will be even showcasing how we are even prescribing and dispensing to our clients. So when I click on the long-acting PrEP, the type of PrEP changes to Cabele, the Pivring ring, or Lenacapavir. So from here, which one will you be initiating your client to? So if again I say Cabele, you'll be able to see just number of months. And even for the Lenacapavir, nothing comes in, just the number of months. And we know it is twice in a year, so give 6 months. And then was there any condom that was issued? When I say yes, I need to give the number. And then from there, I can be able to say whether I gave the next appointment date. And then you can be able to click on the add appointments and then give an appointment. So next, be coming for PrEP follow-up. Then I select the date. Probably let me give 19th of August after 6 months. Then the system will be able to show you on that particular day how will your clinic will be. Then this will be scheduled for the status. This is the provider, and then this is the date appointment or schedule. Then I can be able to save and close. Then from there, I can be able now to save this particular form. So having filled even the PrEP initial form, then from there, I can be able to order any of the lab tests. If maybe the serum creatinine, I will be doing it right now. If not, then I can be able to proceed to the drug ordering. So at this particular point, because today we were not showcasing on the stock management module, I have already received Lenacapavir in our stocks module. And now I'll be able to demonstrate how can I be able to prescribe that and dispense deducting from our stocks. So I'll be quick here because Ogutu talked about this. So I'll just click on the add, then search for Lenacapavir. Just a minute. Allow me to refresh.
Just give it time to load.
Okay. Okay, sorry for that delay. So once you select, you'll be able to see Lenacapavir, and then you click on the order form. Then you can be able to tell from your stocks what you have. So there's what I have in the stocks from the main pharmacy, and even the main store, and the pharmacy that is named main pharmacy Chuka, and I can be able to see in terms of packs. Then I can be able to prescribe, because it will be issued in terms of packs as per how we've been guided. So it will be 1 pack. Then the route, subcutaneous. Then the frequency will be 6 every 6 months. Then if there is any patient instructions, you can be able to give there. And then this is the date when we are raising our prescription. Then the duration will be 6 months. So you need to drop the months. Then quantity to dispense will be 1 pack for this particular one client. No refill. And then you can be able to give the indication. Once you've done that, you can be able now to save. Then you'll be able to see your prescription, and you can be able to sign and close. So once that is done, you'll be able to get a notification that that was successful. Then from there, now you can be able now to assign this particular patient to the next queue, which is the pharmacy. But before I do that, allow me to get back to the care panel and show you what happens when this particular patient comes into the subsequent visits. So again, once you pick this particular, you get the patient chart, you will navigate to the care panel, you click on the program enrollment, you'll be able to see your program there. Again, you'll be able to utilize the options, the 3 dots where my cursor is. Then when you click on that, you'll be able to see other forms popping up. So you'll be able to see the PrEP follow-up form. Allow me to show some of the difference with the earlier one that we had. So this one you'll be able to see, again, starting with the STI screening, as I mentioned that, the fertility intentions. If yes, attain menopause, it will be able to close all other variables, but if no, you'll be able to see the LMP, whether is the client pregnant, and if yes, then we'll be able to close some of variables or questions asking about family planning. But if it's not, then we'll be able to proceed with whether you're planning to get pregnant. Maybe if yes, then are you breastfeeding at the moment? Whether yes or no, then you'll be able to give your family planning status, just as I showcased in the initial form. Then you'll be able to see the adverse drug reactions, not different from what I showcased. When you say yes, you click on the add, then you can be able to add them. Then you get not the PrEP status. This is where you can be able to get some of the difference. Again, at this point, when you say yes, the system will alert you to discontinue. But if no, you can proceed again with the adherence counseling, as I had talked about it earlier in the initial form, and even the contraindication for PrEP. Where we have the changes is the PrEP status. Now you'll not be able to see start because this is a follow-up. What you'll be able to see, it's either you are continuing with the PrEP, or even you want to restart, and this is for those who were stopped at some point, or you want to switch. And if, let's say, for example, it says switch, and I say I want to prescribe today, then I'll be able to see the dosing strategy. The same for the restart or even the continue. And the dosing strategy is the same as what I talked earlier in the initial form. It has 2 responses with the daily oral PrEP or the long-acting PrEP. When I say daily oral, then I need to select the type, and then I select the regimen. If it's long-acting PrEP, then I'll be able to see the type of PrEP being the carbalet, Pivirin ring, or Lenacapavir. Then if I select on this, then I need to state the number of months, and as we have done earlier, then whether you issued condoms, and then the next appointment. So you'll be able to see the only difference between this form and the other form is specifically this particular part here, whereby if even we are switching, we'll need to give the reason as to why we are switching this particular client from one regimen to the other regimen. This is what you'll be able to see for the PrEP follow-up. And again, the other visit, we'll be able to see the monthly refill. And I know these forms do not have many differences in the what the forms do carry, but just what I was explaining on the PrEP treatment plan, the same will appear. When you say switch, you need to give the reasons, and you'll be able to see reasons appearing for you to be able to state the reason as to why you're switching. So that is when it comes to the clinical forms for this particular PrEP client. How do we now, we've raised even the, the prescription. How do we dispense? Once you will need now to queue this particular patient. Once you queue, we'll navigate to where we have this is something which is configurable at the facility level for you to have pharmacy. So I think the server that I'm using has not yet been configured for that, but I can demonstrate because the moment you raise the prescription, the name of this particular client will end up being at the pharmacist's desk. So when I get home, the pharmacist, number one, will need to check your location as a pharmacist. So I need to change this. I have stocks in the main pharmacy, Chuka, or even the main pharmacy. So allow me to use that. Then need to confirm. So as a pharmacist, you need first to check. You need to be in a dispensing location for you to be able to even get the batch number from the stocks. Then from there, the easiest way, just click on the left navigation panel, click on the pharmacy, which will take you direct to the dispensing platform. So from here, I can be able to see my client here and the prescriber, and you can be able to see even the drug, the Lenacapavir. So when I expand, and I know this you are shown on this, then you'll be able to see Lenacapavir here with the instructions that were there indicated during prescribing of this particular drug. Then I can either close, pause, and modify. We were taken through this, but allow me to talk on the dispense. When you click on the dispense, you'll be able to see this information for this particular client. This is the drug that you want to dispense. The quantity that was prescribed was 1 pack. So here, if you want to give, you can be able to give 1 pack. And the reason as to this is editable, it's for you. Maybe what was prescribed may be more than what you want to dispense, so you can be able to utilize this quantity to put what you want to dispense. Then this is just read-only coming from the clinician. You can be able to see 1 pack, the route, the frequency. You can give your own instructions as a pharmacist. Then this is the date when you are doing the dispense, the name of the user who is dispensing. So the reason as well you could be able to see my name here and even on the forms which are used by the clinical team, the clinicians, is because of the roles. I was assigned more than 1 role for this particular training, but at the facility level, we'll be able to give you a role that pertains to what you do at the facility level. So when you look at the stock dispense, then you'll be able to see a batch. This batch is coming from our stock management module, which can be able to manage your stocks and give you even the stock reports when you request in the system. And you can only be able to see this batch once you change the location. You need to be in a dispensing location, and that location needs to be having stocks. Then from there, you can be able to dispense that particular prescription, and it will move from active to all prescription. So I think that's all. Having taken you through all that. But again, once, if you would like to see what you filled, you can navigate to the clinical encounter section here, click on the visits. Then from here, you'll be able to see all the visits, today's visits. You can either expand these, and timeline will give you all what was done, or the providers who filled each form. And if you want to see any of these forms, to see their summaries, you can click on the encounters, then you can be able to expand, and you'll be able to see all that which was recorded, and you can be able to edit if need be. I think that's all from my end. Back to you, Songok.
Thank you. Thank you very much, Eric, for taking us through the workflow. I want to usher in through the dashboard, the mockups. And then first and foremost, Mary Claire will take us through the DORP process. And then Lilian Ligola will take us through the dashboard. There's some dashboards that we've developed. It's work in progress. So we just wanted to give you a quick highlight on what we've been able to do. Then after that, very quickly, our trainer will take us through the SOPs and probably where to access basically the SOPs and the short videos for purposes of just refreshing ourselves at the facility level. So, Mary Claire, I don't know whether you'll start first or Lilian. I think Mary Claire will go first.
Yeah. I'll start first. Just a minute, let me share my screen. Okay, so I'll be going over data transmission. So as been mentioned before, there are some additional variables that have been added to TaifaCare, and we will need to transmit them to the data warehouse. So the DORP datasets, such as the patient extract or PrEP behavior, have been updated with the additional variables. So these are just the lists of the variables that have been added in DORP. Type of PrEP, which would contain, for example, Lenacapavir and amongst other options, and there'll be dosing strategy, other reasons for PrEP, date of switch, and so forth. So these are all the variables that will be added and collected. And if you want any more information on them, you can just find them in the PrEP dictionary. So these variables will be transmitted using the next version of DORP, which is to be released soon. So there's not much change in the process of transmission. So what you'll just be doing is once you're logged into TaifaCare, you'll navigate to the KenyaEMR home and and go to the ETL section, and you'll just refresh the tables. Once you're done with refreshing the tables, that's when you can go to the DORP side and load and transmit the additional PrEP variables that have been added to the data warehouse, where it will be ETL'd and processed in preparation for the analytical work to be done on it. So you'll need the new version of DORP and KenyaEMR. So on the transmission side, it is very simple, and that's all that's there to it. There's not much other procedure that you have to do. So I'll end there and pass it to Lilian to present on the PrEP dashboard monitoring. Thanks.
Good afternoon, everyone. Let me share my screen. I hope you can be able to see my screen. So my name is Lilian. I'm going to take you through the above site dashboards that will be used for monitoring PrEP at the national level. Please take note that this is a mock-up. So it's just like what we expect to see, but there's no much navigation that I can do to this. So on this PrEP dashboard will be part of the case surveillance work stream. as you log into the prep dashboard, this is what you're going to see. We will have on the left, we will have filters based on the assessment period, the county, sub-county, facility, sex, age category, agency, and partner. Then there'll be a button down there that you can use to apply the filters. Then we will have two main tabs. That is the prep initiation enrollment tab. And then there's the prep seroconversion and prep switch. So for the prep enrollment tab is where we are at right now. So on this, we'll be able to see the prep new pregnant women, then the prep new breastfeeding women. Scrolling down, we'll be able to see the prep enrollment by dosage strategy as showcased here. Then on the right side, there's a prep enrollment by dosage strategy. That is the long-acting prep, daily oral prep, event-driven prep with a specific regimen and the number of patients. The same will be disaggregated by county and partner. Then we have the second tab, which contains the seroconversions and the switches. So the first card will show us the number of the total number of seroconversions, then the total number of prep switches. When we move down, then we are able to see the seroconversions by prep type and also the seroconversion by regimen type. Then on the right side, we are able to see the prep regimen switch, the different switches from the different that is from the long-acting to event. So you'll be able to do to filter out the period that you want, and it's going to show you the exact number of transitions from one regimen to the other one. I'll want to end it at that. This is just the version 1 of our mockup. So probably this is what you'll see first as we continue to integrate more indicators. Thanks, and over to the next presenter.
Thanks, Lillian and Mary Claire for taking us through the DWAPI, and of course Lillian taking us through the the mockup. That's basically what we are looking at. It's work in progress. We'll be able to just finally, the data that you're seeing there is not accurate data. It's just dummy data that we're using to visualize as we continue doing the modeling. So Otieno, very quickly, can kindly take us through the next bit, and then I'll take you through the collection, and I think that should be it. Otieno, I can see our dropout rate is quite high.
Okay, so Sungok, confirm if you're able to see my screen.
Yes, I am.
Yeah, so I think this is going to be a short one. So just to ensure that you are all supported in terms of capacity to utilize the new version of TaifaCare, and also to ensure that you're able to go through the prep workflow that we have been taken through in light of the activities that are going to follow this particular training. We have our list of resources online that can help you get started, that you can do on your own. So these are all self-learning resources that you can utilize. So we have the SOPs and the training resources on that link. Feel free to take a picture of the screen. I'll also post the same on the chat box. So we have the training resources in that link. We have the YouTube resources. These are just short videos that would help you get up to scratch in terms of utilizing different components of the TaifaCare system. Also, you are also encouraged to participate in the FAQ platform. So the FAQ platform is our KenyaEMR community platform where you can ask questions and also get your questions answered. You can also participate to answer other members of the community. Lastly, we have the service desk line. I've seen guys asking certain questions from the chat box. You can utilize this line to reach out for technical support to our dedicated service desk that will be able to respond to your questions. Maybe I could just take this opportunity to show the Okay, I'll still share my screen. Sorry for that. Yeah, so this is the website where you can get the SOPs. When you come to KenyaEMR.org, then you come to resources. When you come to resources, you'll be able to now interact with these resources. Of interest is the HIS learning resources, where we have a list of all the SOPs that you want to interact with. Prep service documentation is here. You can always just open it up and just go through it to just understand the process of documenting the prep. And also our test instances are here. Feel free to log in using these credentials so that you can practice on your own. These are test instances, so feel free to post any data just for your learning purposes. Again, also, you can interact with our YouTube, again, through the same platform. When you click on this, you'll be able to go to our YouTube channel. And the first video that you'll see is the how to navigate prep module in TaifaCare. This kind of summarizes what Eric Mugomi has just taken us through so that you can learn how to document your way around prep and how to document the Lenacapavir so that you are able to understand how the workflow works. So these are self-learning videos. Feel free to interact with them. Again, also, for this session, it has been recorded. We'll also be posting it online this evening. So from tomorrow morning, if you missed it or your network had issues or you didn't get something, you are free to log into our website, our YouTube channel. You'll get that video so that you can go through what we've just seen today. Yeah, otherwise, that's all I wanted to share. Back to you, Songo.
Yeah, thank you. Thank you very much, Otieno, for just guiding us on where to access some of those very, very important resources as we continue implementing this. So very quickly, I will just request for 2 minutes of your time and to take you through our requests, our calls to action, basically. What do we expect from your end? Otieno, confirm you can see my screen?
Yes, I can see.
Yeah, thanks. So remember, like Barbara mentioned, and I think she was able to just take us through the list of the counties that would be rolling out prep for phase 1. Those are the counties, and these are the counties that are here. And like I said earlier, we will be interacting with the other counties tomorrow, the 5 that are remaining. I know some may have attended this meeting, which is still okay. And kindly at this point, if there's anyone who probably missed out, kindly ask them to join us tomorrow, because we'll still be able to take you through the same training materials that we've just taken you today. So we've also, of course, working closely with the county teams, we've been able to select. They've been able to select sites per county. Some have picked 10, some have picked more than 10. As long as you're able to support those facilities, I don't think we really have a problem at the national level. So the expectation is that we'll be sharing the new patch, the release patch, of course, that would help you to be able to upgrade. So we'll be able to share the package with all the teams, hopefully before close of business tomorrow. And we are urging you to help in terms of ensuring that you upgrade all the sites. because once the launch is conducted next week, and I think all of us heard what Dr. Barbara said next week on 26th at Riruta. Once the launch is off, then by that time we are hoping that all the facilities that you selected will have received commodities. So we'll expect that we should be then be expected to start dispensing. And remember what Barbara said also, we are leveraging on EMR. So that means all the sites that were selected are EMR sites. So we are not currently going to go to any paper sites. So it's very important for us to ensure that we upgrade our sites, both the EMR and of course the DOAP for purposes of transmitting data to the national data warehouse. So this is where the county health management teams, the sub-county health management teams, and the facility in charge will play a major role, of course, working closely with service delivery partners. So we are requesting that you prioritize once the release, the package is out. We are requesting that you prioritize the upgrade to the selected 10 or 15 or whichever number that you selected. I know yesterday when we were sending out the communication, we were able to share with you those facilities. If you have any other reservations, you can always reach out to the program people. So the county health management teams, we expect that you'll be able to provide leadership and oversight during the rollout period. We are urging that for the cloud sites, once this is sent out tomorrow, the expectation is that by Monday 23rd, you should have been able to start and conclude the upgrade. And for the sites that are on premise, the expectation is that they should be able to have completed the upgrade by, sorry, that must be a typo. That should be on Wednesday 25th, not 15th. Sorry for that. That's a typo. So the other request is that facility staff should be able to use the enhanced prep module as soon as it is upgraded. Remember, this is what we will rely on for purposes of monitoring. The ongoing training recording will be uploaded to the YouTube channel. I think Otieno has already mentioned that. You can also be able to access. The training materials and the SOPs, and all of them have been updated to reflect the current changes. We'll be monitoring the upgrades using the dashboards in the national data warehouse. Remember, that will be our only source of accessing this data. We are hoping that also by next week we should have the final version of the dashboards to enable us to monitor the upgrades and also the data that will start streaming in. We are leveraging on case surveillance. I think that was also mentioned on the case surveillance dashboard. So that means we will be expecting to be monitoring data on a daily basis. And remember, this is very, very, very critical. Our DG will be following this very closely. So we are really requesting that we work closely with all the stakeholders at the county, at the facility at the sub-county level to be able to realize this. So in terms of monitoring, I think I've mentioned that we'll be closely monitoring the upgrades, and we'll be using the national data warehouse to be able to check on the sites that have been able to run their upgrades. The service desk number, in case you have any challenges, I think that has been shared several times, but we won't tire sharing again, just in case you missed out. You have any challenges, always reach out to the team. We've also organized ourselves at the national level, such that from the Palladium end, we'll have a contact health informatics team who will be providing continuous support, either remotely or physical. And these are the contacts of the officers who will be supporting each of the regions. So for Kilifi, Mombasa, and Kajiado, we have Moses Care, and that is his phone number and the email address. For Machakos, Nairobi, Kiambu, Mary Ann will be available to support that, either in case or in situations where you require any of the officers to visit you physically or to support physically or in person, really. So just reach out to the team. You'll be able to work closely and organize for that. Kisii, Homa Bay, Nakuru, Siaya, Bernard Ajwang will be available to provide that support. And for Kakamega, Kisumu, Migori, Uasin and Busia, Frida will be available to provide the in-person and of course remote support. So right from tomorrow, we'll expect that we'll hit the ground running once we share the new package for upgrade. From next week, we should start then monitoring the upgrades from our facilities. Otherwise, I think at this point, I don't know, Diana, whether you have any comments as we close. Maybe you can also just re-emphasize on our calls to action, Diana.
Thanks, Songok. I think you have covered a majority of it. Just to reiterate that by tomorrow we may not put the release package in GitHub because we are doing a targeted approach. So we will be sharing that to the 15 specific counties. So that is both for KenyaEMR and also DWAPI. So both need to be upgraded at the same time so that the data can start streaming in. So the only one point of monitoring what's going on, and I believe even the counties in the call have credentials to the case surveillance dashboards, they'll be in a position to also just see the performance for their counties at different levels. So we can just re-emphasize and that the counties, we can reshare the list of facilities in those 15 counties so that the upgrade is just targeting those facilities and those in those counties. So like Songok said, if there's a team that needs to join today's meeting, training, they are free to join tomorrow. We'll have a repeat of the same. I know we had a particular schedule, but NASCOP will be sharing another link for tomorrow at 9 a.m. So that's all from me, Songok. Back to you.
Thank you. Thank you very much, Diana, for the sentiments. So I think at this point we have come to the end of our training. But before we close, I know we have our colleagues from the program, Ruth and Paul, who've been with us in this call, sitting in on behalf of Dr. Barbara, who was not able to, who had another engagement really. So all right, I've seen your comment, Mike. Just give me a second. I read what you have posted. Please comment on EMR Chibabu integration. So I think discussions around integration, Mike, I mean, we may not really be able to cover that in this particular meeting, but we'll be able to provide you some further guidance on the same, but we may not really have a direct answer to that. Right, I don't know that there's any other comment before I usher in Paul and Ruth. What's the difference between PrEP monthly refill and the follow-up forms, and which one should be filled? Eric, do you want to quickly comment on that?
Yes, Songok, when you look at the forms, we utilize the forms as they were from the guidelines. So the difference there is the clinical aspect that you'll be able to see in one, the clinic follow-up form, and like for the refill. When a refill is being done, there are some of the variables that you'll not be able to see in that particular form. So in terms of the clinical questions in those forms. Over to you.
Yeah, thanks. Then I think there was also another question from Geoffrey Kiriswa asking, why do we have to refresh the page in order for the PrEP enrollment program to appear?
Yeah, again, not all the times, but we've seen that, and it's something that we've tried to work on. Even for those who've been using the system there before, there is a time when you could be able to refresh and the patient summary could not be able to show anything. But right now that has been fixed, and they can be able to try it with the version that will be released tomorrow.
Thank you. Thank you very much. I know I may not have really gone through all your questions, but I just sampled a few. If you have any other questions, you can always reach out to the service desk team because I think our attrition rate has really been too high. So say a word on behalf of the program as we come to the close of our training. And as from my end, this training, looking forward to meeting them. your team members, our other team members tomorrow tomorrow morning in our training tomorrow. So otherwise, thank you, and over from my end. Ruth or Paul?
Thank you, Paul. Thank you, Songok and team, for that good presentation. It was quite enlightening to see that now we have prep in TaifaCare, and I think we'll be engaging. And to remind the teams from the facility, we are rolling out this in 10 facilities initially within 15 counties. And this is highly monitored in all the facilities. So each facility will be accountable for every commodity that is given to them. So make sure that you document properly and you report on time. As you've seen in the dashboard, they will be tracking on a daily basis. So make sure your reports are up to date. Paul will chime in on my computer.
So thank you very much, Songok and the team, for that wonderful presentation on TaifaCare. It's very informative, very interactive, and very simple and easy to follow. I think all the healthcare workers who are here, however, I can see attrition rate is about 60%.
Paul, move closer to the mic, please. We are struggling to hear you.
So thank you very much, Songok and the team, for the presentation. It is very clear and very informative for all of us who are supposed to provide these services to the clients. Yeah, I can see TaifaCare is simple and it is easy to follow. And one of the things I just want to comment that we will continue interacting and interrogating some of the information, because we can see some populations. For example, if you want to follow up and pull some data, I just give an example of maybe vulnerable population. We want to pick data for that, or we want to look for key population, or AYP, or pregnant breastfeeding mothers. Those are important cohort. But based on what I've seen, we have actually addressed GP, that is general population, and also KVP. So we just continue interacting more to see how those population can be segregated and be able to get information based on those typology. Because some of them are actually high risk population whom we are targeting for pre-exposure prophylaxis. However, thank you very much, and I take it back to you.
Yeah. Thank you very much, Ruth and Paul, for the support that you've always provided from the program perspective. Otherwise, I want to just finally take this opportunity to say, see you tomorrow. Have a blessed evening. Thank you and bye.